Hello, everyone. My name is Dr. Ariel Lopez Chavez, and I am your host for this masterclass entitled Five Crucial Steps from Cancer to Health. Let's start by talking about who this is for. This is for people who have been diagnosed with cancer or who are taking care of a loved one with cancer and who are interested in getting access to the latest and most effective personalized treatments and maximize their chances to fully recover. So, what we're going to be covering in the next 5 minutes is the step by step game plan that our patients are using to get that type and level of care that we were just talking about. We're going to go through the reasons why one size fits all type of treatment approaches are no longer the best strategy to achieve that type of outcomes. And we're going to be talking about how we help our patients assemble a team of national and international experts that can help them get access to those latest and most effective treatments and maximize their chances to fully recover. We're also going to cover the crucial steps our patients use to improve all aspects of their well being, their physical, mental, and social well being, even while going through a cancer treatment. We're going to be talking about how our patients learn to effectively deal with the anxiety, sadness, and fear associated with the diagnosis of cancer. And finally, we're going to be talking about how we help them do all of this with the use of telemedicine and by working with their local physicians to achieve the outcomes that they're looking for. My promise to you is that by the end of this presentation, you will have a step-by-step strategy to get access to the best medical care and treatments available to maximize your chances to fully recover. Okay, so let's start with the presentation, and we're gonna be starting with one of the most important aspects, or probably what is actually the most important aspects of our health, which is mental health. So let's do a mental check-in first. Now, I know that for many people, this is just something that they don't want to confront, that this is a deterrent. But I'm going to tell you just upfront right now that without addressing mental health and mental health issues, without addressing the emotions and the feelings that arise as a result of cancer, it's just simply not possible to say that you're maximizing your chances to fully recover. I know, by experience, many of my patients, many of the patients of my colleagues, they refuse to address mental health issues. They refuse referrals to get those mental issues addressed. And this is really something that is very sad, because what we have seen inside multiple scientific studies is that by doing this, then we really help them not only process those feelings and emotions, but we improve their quality of life, and surprisingly, their chances of recovery, their actual chances of surviving longer or surviving in general, they get improved with these type of approaches. So with that, then let's move on to the mental health check-in. And I'm going to ask you if any of the following sounds like you. Are you overwhelmed by the fear of cancer? Or are you extremely worried about the worst possible outcomes, and maybe you cannot stop thinking about what's going to happen and what would happen to you or your family, if the worst comes to happen? Are you very anxious because you lack a clear picture, especially at the very beginning after diagnosis, or when a treatment has failed, or even you have maybe finished your treatment and you still lack a clear picture of what to expect? Or are you frustrated about the lack of information that you're getting from the short doctor appointments, or from what you're finding in the internet? Or are you worried about the medical care and treatments that you're receiving? And the big question here is, are you secretly terrified that the cancer has a hold over your life and there's no way out of it? Well, if you share any of those feelings, then I want to tell you that this is normal and you're not alone in these feelings. Most people that are diagnosed with cancer go through these feelings. and they're completely normal. And I know that they're hard to cope with, but I want to tell you that there is hope. Today, more than ever before, with all of the advances in medicine that have taken place over the last decade or two, really, there's no better time to have hope. Okay, and we're going to be helping you with that. Now, the big problem, as I mentioned before, is that, unfortunately, many people refuse to address these feelings and to work through them. And in general, many people then, by doing that, they also just refuse to take the necessary steps to overcome not only their mental health challenges, but to really overcome the cancer. And I want to tell you that we're here to help you do just that, overcome that. And that's why we have put together all these 5 steps that we're going to be talking about, because we know that once you take them, you will feel more in control of the challenges that you're facing. You will feel that you're better informed, have a clear picture of what to expect. And little by little, as you're taking these steps, then you will build the confidence and ultimately the peace of mind, knowing that you're doing the best that you can do to overcome these challenges and ultimately maximize your chances of recovery. Okay, so with that, let me tell you a little bit about me. I'm a medical oncologist and I am board certified by the American Board of Internal Medicine. I have had the fortune to train and work at some of the top cancer centers in the world, including the US National Cancer Institute in Bethesda, Maryland, the National Naval Medical Center, now known as the Walter Reed National Military Medical Center, where I was named one of the top 5 oncologists for exceptional customer service. I have worked at the Oregon Health and Sciences University Cancer Institute, which is called the Knight Cancer Institute in Portland, Oregon, and at the Sylvester Comprehensive Cancer Center at the University of Miami in Miami, Florida. I was also the head of oncology strategic innovations at Roche Genentech, which is the largest one of the largest pharmaceutical companies in the world and the leader in the development of innovative cancer treatments worldwide. I have had the fortune also to be involved or to directly lead the development and invention of multiple FDA approved cancer treatments that are now helping tens of thousands of people all over the world live longer lives and with a much better quality of life than they would have without them. So, with that, then let's move on to discovering the 5 steps. So, let me just tell you a little bit of how these steps came about. Over the last few years, and actually really my entire oncology career has been focused on identifying the reasons why some patients do better than others. Even sometimes, we have observed that there are patients that have exactly the same characteristics. Their cancers look exactly the same and they have the same genetic characteristics. And some patients do significantly better than others. And I have been very interested throughout my career in finding out the reasons why. And what I have found out is that aside from the genetic characteristics and the individual characteristics of the cancer, then many of those reasons come down to choices and strategies that some people take and that others don't. And in order to inform everyone of what those choices and strategies are, then that's how I came up with these 5 steps that we're going to be discussing. And I consider these steps to be crucial in anybody's journey from cancer to health. So let's start by talking about what they are. So the first step is to take charge of your health. Here, I'm talking about the mental perspective of taking charge. Once again, we go back to the central aspect of our health that is crucial to take care of as we're trying to overcome the challenges faced by any difficulty. And cancer is not the exception here. Really, taking charge of our mental health is one of the most important steps. As we have discussed, those feelings of overwhelm, those feelings of fear, those feelings of worry can really overtake you, and then can just completely cloud you and block you to any reason, or to making the right choices for your health. And one of the first steps that you can do to overcome that is then to take charge and develop a feeling of hope. Because as I have mentioned before, today more than ever before, there is hope. And replacing those feelings of worry and anxiety and overwhelm by hope is one of those most important steps that you can do as you take charge of your mental health. The second thing is that then you need to realize that there are choices. There are always choices. There's not only one choice, right? And then as you develop that feeling of hope, then also realize that you have choices and that you're ultimately in charge of taking those choices. This is extremely important, right? Because then that's going to allow you to not just take one opinion by one physician or by a healthcare practitioner. You need in many cases then say, okay, well, if that opinion really is not what I'm looking for, then I need to be aware that there are choices and that I'm in charge, and I'm going to go outside and look for other answers, other opinions, other your system checks, quality control. And that is incredibly important. But once again, more than that, more than just the focus on the cancer, is our mindset, right? And I cannot stress that enough. And that's why this is step one. We need to take charge mentally, take charge of our mental health. Now, the second step is also an extremely important step, and it comes down to choosing the type of approach that we want our treatment to be about. And that step is about choosing precision health as the approach that we're deciding to be treated with. So there are essentially two types of approaches when it comes to cancer care these days: the old approach and the new approach, which is called precision health. So let's compare both of them. The old approach in regards to the treatment type is, in general, what we consider one size fits all type of approaches. This is approaches in which, since we don't know the individual characteristics of the cancer or of the person itself, since we don't know them intimately, then we end up using one size fits all type of approaches, such as very conventional type of chemotherapies at very high doses, or other approaches that are not necessarily personalized. Sometimes surgery can be that way, sometimes radiation therapy can be that way. It depends, but it comes down to not knowing the particular characteristics or details of the individual that we're treating, as well as of the cancer. As opposed to that, with precision health, we know those characteristics intimately, and we're going to be seeing what those characteristics are in just a minute. But there's a big difference in when we give treatments that are, that lack personalization and lack precision, versus the ones that are highly personalized, because we have learned over the last 2 decades that personalization, that targeting the particular characteristics that make a cancer and a person unique, gives us significantly better results than when we were using one size fits all approaches. So that is the first difference between the old approach and the precision health approach. The second big difference is in regards to the treatment scope. And here I'm referring to what we're focusing to treat. Right? With the old approach, the treatment scope is very narrow. It focuses on the cancer treatment only, right? So it's just about giving chemotherapy or even targeted therapy or immunotherapy, that are more modern type of approaches. But still, if we're only focusing on treating the cancer with these type of approaches, including surgery, radiation, and any kind of systemic treatment for cancer, if that's the only thing that we're doing, that's too narrow of an approach, right? We cannot say that we're maximizing the chances of someone surviving the cancer if we're only focusing on that, not with the scientific evidence that we have now. Right now, what we know, as far as we know now in 2022, then the treatment of cancer needs to be comprehensive. It needs to include, obviously, the latest and most effective cancer treatments per se, but it needs to include other important aspects of our health, of the person's health, including their nutrition, their functional abilities, meaning kind of like physical abilities, basic and advanced, their sleep, and their mental and social health. Okay, so I mean, without a comprehensive approach, we really scientifically, we cannot say that we are maximizing the chances of a patient surviving. Okay, so I want to present to you with these two approaches so that you're aware of what you're going to be presented with and that you choose wisely to truly maximize your chances of surviving. Okay, so you may be wondering, okay, how often is the old approach being presented to patients these days? Right? And I'm going to show you here, what I'm showing you here, it's a shocking statistic that I learned last year at the annual meeting of the American Society for Clinical Oncology, which is the crown jewel meeting for oncologists worldwide. Right? What we were presented with last year was that only 46% of patients with newly diagnosed lung cancer, which is the number one cause of cancer-related death in the United States and in the world, only 46% of those patients receive the most comprehensive set of genetic tests that are required to guide precision health treatments. And only 37% of patients with that type of cancer receive the latest type of genetic test required to guide precision health treatments, right? So these numbers are completely shocking. I was not aware that we were there, right? Because these type of genetic tests, this comprehensive type of genetic tests and the latest type of genetic tests are available everywhere in the US, and most insurance companies pay for them, right? So, when you look at those numbers, then it's really shocking. I mean, everybody with cancer, everybody with this particular type of cancer should be getting access to these latest type of genetic tests because they're absolutely required to guide precision health treatments, right? So if we truly want to be personalized, if we really want to be precise in regards to the treatments that we're prescribing, then these type of genetic tests are absolutely required. Okay, and here we're just talking about one aspect of precision health. We're simply talking about the latest diagnostics, one of the latest diagnostics. But unfortunately, when we look at other aspects of precision health, such as, okay, how many patients get their mental health addressed? How many patients get their the nutritional support that they need? How many patients get their functional abilities tested, such as like their fitness, their strength, things related to exercise? How many of them get them addressed? Right? That has also been shown to have enormous impacts, not only on the quality of life of the patients, but also we're seeing more and more that many of these aspects from the scientific perspective then have an enormous impact on their survival. Right? So that's why it's just extremely important that then we choose precision health. If we want to be scientific, right, we need to address all of that, starting with changing these statistics, right? Rather than only 37% of patients with newly diagnosed lung cancer or with any type of cancer, because these days genetic tests are absolutely required for most patients diagnosed with any type of cancer. Rather than having that low number, we really need to give the opportunity to every single patient to get the latest type, not only of genetic tests, but the latest type of assessments that will allow us to guide their treatment with precision. So you may be wondering, okay, I'm with you. I should get precision health. So how do I do that? So step three, it's about getting what we call a poem. And a poem, it's simply an acronym for a precision health plan. So a precision health plan would be a plan that incorporates all the concepts of precision health, right? And what that plan needs to be focusing on in order to be both precise and comprehensive needs to be focusing on three things. The first one is obviously on overcoming disease, right? Cancer is the most pressing issue right now. Then we need to be focusing on overcoming the cancer, overcoming disease, right? But we also need to be focusing on enhancing the person's well being, right? We need to be focusing on making sure that whatever toxins or whatever causes, whatever like ultimate causes of the cancer were, that we're addressing them, that we're helping patients, right, getting rid of those things that were causing the cancer in the first place. And not only that, but also enhancing aspects of their well-being that also we have seen that have an enormous impact both in the development of the cancer or in its progression, such as the nutrition, sleep, fitness, mental health, and social health. All of those are extremely important aspects of health, right? And we need to address them appropriately. And that's what we refer to as enhancing well being. Same thing as maintaining long term health. We really need a long term plan to maintain their health, right? It is not enough to just come up with, okay, well, we're going to treat your cancer, we'll enhance some aspects of your well being, and then they just leave you and then only monitoring the cancer, right? We need to ensure that whatever factors were there at the very beginning, right before the cancer was formed, whatever factors were taking were related to the cause of the cancer, that we're eliminating them long term. And we need to make sure that we have a plan so that we're monitoring you effectively to avoid any new surprises, right? To make sure that we have an early detection plan incorporated to that maintenance of the long-term health, and that we have a plan for you to stick to all of the recommendations that we um, provided when we made your plan to enhance your well-being, right? So in general, then what a poem comes down to, it's a very highly personalized plan to maximize the chances of recovery and improve overall health, right? And let's just compare that to like what a tradition, what the old way of treatment plans, what was focusing on, right? Or some of the drawbacks of those old type of treatment plans. First of all, as we discussed before, many of those plans, they lack precision, right? If you're only testing 37% of the patients, in most of the patients, they're not getting the latest genetic test or the most comprehensive test, then you're lacking precision, right? If we're not ordering those tests, if we're not have those tests as part of our arsenal of assessments, then we're going to be lacking precision, and we're not going to be able to prescribe the best and most effective treatments. And you're going to see that as when I share with you the story of one of my patients, Jane. Now, the second drawback is that once again, these all treatment plans are not comprehensive. If you're only focusing on the cancer and not focusing on other very important aspects of well-being that have been demonstrated scientifically to have not only an impact on your overall health, but also an impact on on your survival, then you're really not providing the maximizes the chances of this patient the, to have a full recovery. Now, the other important drawback of all the other ways of treating patients is the limitations on time, right? So, it really takes a significant amount of time to spend with a patient to really give them a treatment that is precise, to give them a treatment that is comprehensive in the way that I have just described, right? And unfortunately, many healthcare systems are experiencing shortage of doctors, tremendous amounts of burnout, and shortage of many other healthcare practitioners. And as a result of that, then just the limitations of time, have continued to increase, right? And that is a very sad thing, because cancer patients need a lot of time, and we need to give them a lot of time to mentor them, to counsel them, to inform them so that they can make the best decisions, right? This is not a trivial issue, and we're not dealing with a very trivial disease. This really requires a lot of time. And in the old ways of treating cancer, in which, we only have like 20-30 minutes appointments, that's really not enough many times to really provide the type of comprehensive and precise care that precision health requires. The fourth drawback is an absence of a systematic process, right? Over and over again, what I have observed, not only in the United States, but all over the world, is the absence of a systematic process, right? A systematic process that allows us then to say, okay, well, all patients need to get the most comprehensive type of genetic test and the latest type of genetic test. All patients need to be getting, a comprehensive approach to their care, right? That all patients need to have an, certain minimum amount of counseling, right? Then just have a systematic process that allows us to really, right, provide high quality care consistently. And that is something that unfortunately is absent in many healthcare systems around the world. And finally, a lack of quality control and oversight, right? If we lack a systematic process, at the very least, having a quality control and no oversight on how those patients are being treated, then would be the very least that we can do, right? At the very least, then catching it as it happened, right? If a patient was not given the latest and most comprehensive type of genetic test, then somebody needs to be there to oversee that, and to catch that systematic error, right? But as we see by those statistics that I just presented with you, it seems, a lot of healthcare system lack of that quality control. Otherwise, those numbers would not be as low as they are, right? So those drawbacks are really, holding many patients back. So now let me walk you through, Ken, what the difference are with the new way, right? A precision health plan. A precision health plan is intended to be highly personalized, as I mentioned, right? So, and in order to be highly personalized, we require to perform a precision health assessment, right? To have the most information that we can about the person that we're treated, their individual characteristics, as well as the individual characteristics of the cancer. So we need to have the latest type of assessments. And we're going to be talking about in the next slide, because that's at the core of a precision health plan. The second step, or the second characteristic, is that our precision health plan, our plan to treat cancer, needs to be comprehensive. And by comprehensive, I mean that it has to obviously focus on the cancer, but it also needs to have the components of enhancing overall well-being and maintaining long-term health, and taking care of all the aspects that are important to really be comprehensive. Primarily these 5 core aspects that I just mentioned: mental health, social health, nutrition, fitness or physical functionality, and sleep. At the very least, those 5 components need to be integrated into the care of every cancer patient with cancer. And finally, then we need a systematic approach with quality control measures, right? In which we're able to systematically treat every patient, and then also systematically have quality control checks that ensure that every patient gets the highest quality of care possible. Okay, and this is what characterizes the new way of treating cancer with precision health. And at the core of this type of way of treating cancer with the precision health plan, at the core of that, it's a precision health assessment. And here we need to incorporate the most comprehensive and the latest in genetic testing, physiological and mental assessments, right? Because what that's going to allow us to do is to really know who we're treating and the type of cancer that we're treating in depth, right? Because what we're going to need to do, and when we do, then once we have those latest genetic tests, is that then we need to present the patient, or we present the patient with personalized and comprehensive menu of options, right? You need to be presented with a menu of options because you're the one who are in charge. And you, as an individual, as the person with cancer, you're the only one who knows yourself the best, right? So we cannot prescribe to you kind of like what is the best option. We can only tell you what the options are. We present to you the benefits and potential harms, the potential benefits and potential harms of those options, but you're the one who is in charge of deciding, right? So this is what precision health assessments allows us to do. By knowing you intimately and by knowing your cancer intimately, then we're able to provide you with that personalized and comprehensive menu of options for you to make the right informed decision and to have the peace of mind to know, right, that you made the right decision based on the information that was provided to you. And once you make the right decision, then from there, then we need to customize a world-class medical team to execute on that, right? But it is not until we understand what your needs are, what your individual characteristics are, and what the individual characteristics of the cancer are, it's not until we know all of that that we customize the medical team for you, right? Because there are a lot of experts on many different type of cancers. One of the wonderful things of the American healthcare system is that it has allowed for the super specialization of medical care, right? And what that has allowed to happen in the United States is that then we have specialists for every single type of cancer. Not only for every single type of cancer, but some of them is specialized at the, at the micro level, at the genetic level. So like in lung cancer, there are people that specialize just on one type, like on small cell lung cancer. Some people have dedicated their entire careers to focus on just one genetic abnormality, right? And the same thing comes for as far as surgeons, right? So some specialize on one very specific type of cancer, let's say mesothelioma, right? Some other or people that specialize just in breast cancer. And in breast cancer, for example, some of them, they just specialize in one type of, or they have dedicated a lot of their time in specializing in one type of reconstruction. Some people, some healthcare practitioners specialize in the treatment of lymphedema, you name it, right? So, but in order for us to provide you kind of like with the best world-class medical team possible, then we need to have that assessment, that very comprehensive and personalized assessment, to present you with the options, to know what your characteristics are. Then you need to choose, and then from there, then we go and then build the best team possible to maximize your chances of survival. So that this is all what step 3 is all about. And now then, just to illustrate a little bit better that, then let me tell you the story of one of my patients. Her name was Jane. Well, not her real name, obviously for privacy reasons. But she was a 44-year-old mother of 3 children. And her three children were school age, all of them. She was a single mother, and she was diagnosed with lung cancer that by the time it was diagnosed, it had already spread to the brain, liver, and bones. Unfortunately, and full precision health assessment was not done. Some type of genetic test was done, but it was not comprehensive, and it was not the latest type of a genetic test. So she ended up being offered, chemotherapy, a conventional chemotherapy, the type of chemotherapy that we prescribe when either the patients don't have, any other gene that we can target, or just simply that we just didn't perform the assessments, and then, or we couldn't perform the assessments, and that's the only thing available. So unfortunately, that chemotherapy didn't work, and she was told that she only had 6 months to live. So imagine the pain, imagine the worry, right? She's only 44, and there's 3 school children, and she's the mother for the 3 of them, right? So now that is well, I mean, every single situation when somebody has cancer is overwhelming, but just imagine, I mean, it's just that has been one of the, when I treat people in these situations, it's just simply I can understand the overwhelm, and I understand it with all the patients. But Jane, for some reason, then just she keeps crossing my mind, every time that I think about these situations. But anyway, so she had to overcome those feelings, take charge of her mental health first of all, right? Because if she would have been overtaken by the fear, by the overwhelm, right, she would have never left, her hometown and came to see me, right? She would have never have done that. But then she had to overcome those feelings. She had to clear her mind, decide that she had choices, pick up the phone, make an appointment, and then come see me. And then I'm glad she did, because we perform a precision health assessment, and as part of that precision health assessment, she got the latest type and most comprehensive type of genetic assessment. Unfortunately, then we found that she had an abnormality in her cancer that is called an ALK rearrangement, an ALK rearrangement. And we didn't know that thing existed. That type of abnormality existed before 2007. That actually was just discovered in 2007. And by 2011, we had a new treatment. And then after 2011, we have had incredible development of medicines for that particular type of cancer with a genetic abnormality. So we offer her treatment with that particular type of medicine. And then I'm putting the reference to that particular type of medicine there. If you're interested, then you can check out those articles. And together with the treatment of her cancer, as I mentioned, as we do with all of our patients, then we offer her a comprehensive suite of health interventions addressing, her physical, mental, nutritional, sleep, and social health. So as a result of all of her treatments, then 5 years later, then she was still alive, still taking her medicine, and her children had graduated from high school. At least two of her children graduated from high school. She had an overall improved health, and she was personally thriving. So this is what is possible with precision health. And then you may be wondering, obviously, all doctors have a story in which somebody has survived, right? So everybody will have an amazing story. Now, the very important thing about this is that with these type of new medicines that precision health has brought us, with this in particular, if you look at the results of this particular medicine that we used and that is referenced in here, when we use that particular type of medicine for patients that have that particular type of cancer, more than 50%, they have a more than 50% chance of surviving more than 5 years. Right? So here I'm not talking about then just a one-off type of experience, right? If you go out and then ask, all doctor, any oncologist, okay, well, what are the chances of surviving for a patient that has an ALK rearrangement, has lung cancer and has an ALK rearrangement? That's more than 50%. If you give them the right medicine, though. Right? If you don't do the assessment, if you didn't do the latest genetic assessment and you missed that you had an ALK rearrangement and you don't treat them with that particular medicine, then their chances of surviving are less than 1 year. So I want to pause in here and then just once again stress that out, because that's an incredible difference. If you didn't perform the latest and most comprehensive type of assessment and you missed that Jane had an ALK rearrangement as a result of that lack of precision, and you didn't give Jane the opportunity to receive that medicine, then you're essentially robbing those children for the opportunity to have a mom that sees them, that takes care of them until they graduate from high school, right? It's an enormous difference in outcome. Okay, so I hope that I'm making my point really clear in here. So with that, then let's move up to step 4. And step 4 is to act with urgency. because time is of the essence when it comes to cancer care, right? Cancer moves really fast. Many cancers move extremely fast. And we have seen over and over again in multiple scientific studies that every week of delay, especially after the first 6 weeks of treatment, but every week of delay then decreases the chances of recovery from cancer. So we need to be very diligent, right? And we need to just make sure that, everybody in the healthcare system where we're being treated, moves with the speed that it requires to appropriately treat cancer, right? It's just everybody needs to be on the same page with that. Whoever is ordering the genetic test, is just make sure everything is done on time, not only on time, but with urgency, right? Because we want everybody to have the best chances of recovering from cancer, right? And we don't want that delay, to have anything to do with decreasing anybody's chances from surviving. So finally, we come down to what is step 5. And that it's just not simply, but to invest in mentoring, right? Because by investing in mentoring, that's what put everything else together, right? Precision health is a complex field, right? It's complex because it's very comprehensive, and it's addressing, an issue, which is cancer, that is very complex, and that is getting more and more complex by the day, because there's enormous amounts of development of new treatments and new interventions for cancer. So it really takes time to get up to date, right? And then if it takes time for physicians to get up to date, then imagine for a patient or a family member that is trying to find out what are the best options for them, right? It is just very hard to just going to the internet trying to find that out. It's very hard. Not only is very hard, I mean, because eventually it could be possible. I mean, anybody can master with enough time invested. Everybody can master anything, really. But the thing is, here we're talking that time is of the essence, right? You cannot wait until you get a PhD in a particular disease that you have or that your family member has to kind of like to start making the decisions that you need to make, right? And then that's why when it comes to cancer care, then mentoring is especially important, because you need mentoring and education by expert physicians. And here I'm talking about people that physicians that specialize in cancer care, right? So that you have the right information at the right time when it matters the most, right? Now, the other thing for that is very important for in regards to mentoring is that then the mentoring will give you that quality control and systematic check that you need, right? But even if your healthcare system does not have that, then you can bring it with you, right? You can have other physicians being that quality control and systematic check that is lacking at the particular healthcare system, right? And this, once again, I'm going to stress this, that is very important, because to give you an analogy, you would not buy a house from a constructor that doesn't use blueprints, right? So that's the systematic check. If somebody doesn't use blueprints, would you buy a house from a constructor like that, a construction company like that? Or would you buy a house then, without an inspection, an independent inspection, right? We don't buy a house from, without inspection. Well, our realtor is going to tell us, well, you're crazy. Why are you waiving the inspection? Right? And that's to buy in a house. Then why would we do it with one of the most important thing that we have, which is our health, which is our life, right? So, and then that's where it's extremely important to have quality control and systems that ensures that we get the best quality care. So in general, mentoring, it's crucial for getting also a clear picture of what to expect, to be well informed, and to ultimately make decisions with confidence. And ultimately, then just to develop the peace of mind that we need, right? To overcome all those feelings that we were mentioning at the beginning of anxiety and worry and fear. So this brings up then also another one of our patients, or the family members that look for our help as well. His name was John. Once again, not his real name. But his wife was diagnosed with breast cancer, and he was very frustrated about the short appointment visits that he had. Also was very frustrated about he not really being able to have like a one-on-one time directly with with the physicians that he was seeing. And in general, he didn't really have a clear picture and didn't have all the information that he really needed to be at peace. So we worked with him so that he could get the clinical knowledge that he needed fast to make the decisions that he needed fast, like who are the best physicians, who are the best surgeons, what are the latest and most comprehensive types of tests that her wife needed to have, and enhancing the information that was given by their physicians, then explaining in more detail the benefits and harms of the particular treatment options that she was presented with, and just essentially answer at length all the questions that he and his wife had directly by expert physicians. And eventually also we were the quality control and systematic check that he needed to develop the confidence and peace of mind that he needed to just confront the challenges that he was facing as a result of the cancer that him and his wife were facing as a result of the cancer. So we're at the 45-minute mark, and what we have, as I have mentioned before, then what we have reviewed is the step-by-step game plan that our patients are using to get the world-class medical care that they're looking for and the access to the latest and most effective treatments. How they're doing that all by choosing precision health and getting precision health incorporated to their treatments. I mentioned why one-size-fits-all treatment approaches are not the best strategy, not anymore, not in 2022, right? We need precision for the treatments. We need the treatments to be comprehensive. Otherwise, we cannot say that those treatments are truly maximizing the chances of survival for a patient. And we have gone through how we're helping our patients assemble a team of national, international experts, how we do that after we have a precision health assessment that tells us their individual needs. And then with that, then just we go ahead and assemble them a team of national, international experts. We went through the crucial steps they use to improve all aspects of their well-being, just essentially from the step 1 of taking care of charge of their mental health to step 3, in which they're given a comprehensive suite of interventions to focus on everything that they need to focus their overall to improve their overall well-being, and how they're using all of that to effectively deal with anxiety, sadness, and fear, right? Because essentially they're working on everything that is important. They're developing the peace of mind that they need, right? Because they have peace of mind because they have someone that does the quality control, that does the systematic checks, and it's bringing them with all the information that they need to make decisions with confidence and have the peace of mind. And what we didn't talk about is how we help them all do all of that with the use of telemedicine, right? Before, in the earlier stages of my career, people will have to come and see me. And then after 2020, after the COVID pandemic, then we went all uh, online, and then it's everything used through telemedicine. And we work with their local physicians, and we work with physicians all over the U.S. and all over the world, essentially, to to provide them with the services that we provide them, right? As I mentioned, many of these latest and most comprehensive types of genetic tests or mental assessments and physiological assessments are really available, all over the United States in particular, in many parts of the world as well, right? So it is just extremely effective to use telemedicine to do all of that. And then that also helps the patients not having to leave home, right? Because having to travel, just having to take a plane and then go to everywhere to the best cancer centers, if you will, to get that, then it just takes a stress on patients. And besides, many of these top cancer centers like the Dana-Farber Cancer Institute, Memorial Sloan Kettering, MD Anderson, many of them, then they're offering telemedicine appointments as well, so we can coordinate appointments with them as well and get the best experts on board everywhere in the country or in the world. And everything can be done through telemedicine so that we can focus on the most important things that can help a patient get the best chances to maximize their health. So just to summarize, once again, the 5 crucial steps that our patients are taking is to take charge of their health, in particular, take charge of their mental health, develop that hope that they need, and develop the realizations that they have choices and take charge of those choices. And then with that realization, then choose the right approach that gives them the best chances to maximize, their chances of survival, and that's precision health. And once they choose precision health, then to get a precision health plan that covers the three basic aspects, the three most important aspects, which is overcoming disease, in this case cancer, enhance their well-being, and maintain long-term health. Then we also discuss how they need to act with urgency. Everybody needs to act with urgency because time is of the essence when it comes to cancer care. And finally, invest in mentoring so that then you get the right information at the right time when you need it and all the support that you need, right? And how they're using all of that then to get the outcomes that they're looking for. So now then you have choices, right? And you can choose between an all approach or you can choose a precision health approach, which really, once again, just from the scientific perspective, then a precision health approach, given that it's personalized and comprehensive, really gives you the best chances to have a full recovery and to have the best quality of life possible. So now we know that in many healthcare systems, they're having a hard time providing precision health to the level that it needs to be provided. As I mentioned before, in the statistics that I mentioned, many healthcare systems are having a hard time providing patients with the most comprehensive and latest type of genetic test available. Many healthcare systems are having a hard time providing their patients with enough time to inform them, to counsel them, to mentor them, with enough time to provide a comprehensive suite of options and interventions. So we can help. We can help to close that gap. So in order to do that, then we are offering people a chance to book a time to speak with us, and we can help you figure out how to use all of the ideas that I just presented to you, free of cost. So you can talk to one of the members of my team or sometimes to myself as well. And we will be happy to speak to you about how to do all of that. However, this is only for people that currently have cancer, or their primary caregivers, and that are interested in a precision health approach, understanding that the precision health approach is truly a comprehensive approach, right? That will not only focus on the treatment of cancer, right, but also focuses on the enhancement of overall well-being and health, right? We only work actually with people that are, that are interested in that comprehensive part of approach, right? Because this is extremely important. As I mentioned before, right, the mental health aspect is extremely important. That's something that we really take very seriously and we work on continuously. So if you're interested in that, if you're interested in precision health, then please go ahead and book an appointment now. Once again, then I mentioned, then we're doing this because we know people need help with this. We know that currently the US healthcare system is experiencing significant limitations to the application of precision health, and we can be of help, and we want to be of help to you. So in order to make an appointment, then you can go to poemhealth.org/apply. And there, once you click that link, you will be taken to a calendar and you can just make an appointment there. After you make an appointment, then you will be taken to a questionnaire. We're asking you some basic questions such as what kind of cancer do you have and what has been done so far. All of that is to give us enough information for us to have and discuss with you at the time of your call. And the spaces are very limited, so please just go ahead and sign up. Time is of the essence, and we would like to talk to you. Once again, go to poemhealth.org/apply to make an appointment with us. We will be happy to be of help. So with that, we have come to the end of the presentation, and I hope this has been useful to you. And I hope that you're able to apply these steps in your recovery process, So I wish you the very, very best for you and your family. Thank you so much for listening and have a great rest of your day.